Hello, good afternoon. I'm just here to speak very briefly about the challenge that we set and perhaps why it wasn't a very good one. In our routine assessment of the lower limb arteries, Giles initiated a sequence in our centres based on work by many of the board members and former board members of the society to produce ultra high resolution images in the femoral and crural regions. And I spoke earlier in the week about the importance of that and how incredibly helpful they are. This is the sort of image quality that we can get. As Professor Neeson has already described, the arteries and veins are well enhanced. In this patient, it was someone who had very proximal, fairly minimal disease, and so there's predominantly arterial opacification and the arterial filling rather, and the veins don't show up quite as brightly. However, in our more diseased patients, kind of a more representative example of what we get is something like this. There may be varicose veins, as shown in the left calf. There are arterial stenoses and occlusions. Some of the arteries are completely absent for very long segments, and this makes standard methods of segmentation like vessel tracking, it makes them perform extremely poorly, and it also limits our ability not just to analyze these images, but to show them to our vascular surgeons and other interventional radiologists to show them where they need to get to if they're going to perform a revascularization procedure. So this is a segmentation that was performed with standard vessel segmentation methods, vessel tracking. It performs not too badly in the arteries, although you can see more distally once you run into any disease or stenosis, it doesn't work particularly well, and the veins are incredibly variable. Any bit of deformed vein can happen because since there's such low pressure structures, any bit of deformity means that the tracking just doesn't work and segmentation is extremely poor. So we posed PAVES, the Peripheral Artery Vein Enhanced Segmentation Challenge, through the Grant Challenges website. And the data sets that we gave were 32 sets, each comprising a MIP of the twist. This is really just to give a purely visual overview. Then the best arterial time point from that twist was given as a non-subtracted volume. So the arteries would be completely enhanced, but there should not be any venous contamination on that at all. And then our 0.5 isovolumetric kind of equilibrium phase acquisition. They were also given some instructions and details about the anatomy of the arteries and veins, and a little bit of information about DICOM and the potential for using a subtraction method to use the arterial only set from the twist to potentially subtract that away from the high resolution images to do some volume matching. And that was the challenge that we posed, and there was a lot of interest, but I think a huge number of the participants found it too difficult without a labelled ground truth. So our first speaker is going to be Rui.